Epicc stands for Edmonton Prostate Interdisciplinary Cancer Clinic, and what we are is we are a multidisciplinary clinic. We use a team-based approach to care for patients with castrate-resistant prostate cancer. We have 3 urologic surgeons, 3 medical oncologists, and 1 radiation oncologist. And then we also have a pharmacist and an RN working within the clinic. As the nurse coordinator, I do a lot navigating behind the scenes. So we have a lot of patients who are in rural Alberta, and I'll sort of guide them along with local patients through the healthcare system to ensure that they receive timely and appropriate care successfully.
I think overall it comes down to what is the patient's satisfaction with the quality of the visit that they had. Sometimes it's 5 minutes, sometimes it's an hour. But I think it all comes down to patient satisfaction. So when they leave here, do they feel that their questions have been answered? Do they have a good understanding of what's going on at the visit in terms of what they need right now, and then moving forward when they return to clinic for their follow-up?
After I had prostate cancer surgery, my surgeon was overseeing my situation, my case, and when my condition became castrate-resistant prostate cancer, he said the best care assistance would be this team, this Epicc team. So he described it and really encouraged us to come here. I think it's a lot more comforting to hear that many eyes have looked at my situation, and maybe that gives me more confidence in the treatment options.
As a group, we encourage not just the patient to be there, but often the spouse, kids, best friends, whoever they have as a support group around them is encouraged to come to the visit because it's part of the conversation. The other thing is you're often dealing with elderly patients who they may appear to be listening to what you're saying, but their retention may not be very good. So an extra couple of sets of ears is often a great benefit because he may walk out of the room and not really retain what was discussed, but hopefully someone else who was in the room does retain what was discussed, and so there's a clear picture of what's going on.
They definitely are knowledgeable, and they have a very good understanding of all of the opportunities that could be accessed for providing care. So with that knowledge and the ability to link, like Brian with his connection directly at the Cross Pharmacy, makes it really easy when Paul needs a different drug or a refill on something. We know that Brian will make that connection at the Cross, and it's very easy to go pick it up there. Being able to call if he's concerned about something that doesn't feel quite right, or just the easy access has been very helpful.
With the new patients, I'm looking a lot of times at their medications, any other conditions that they might have, and then when we have our rounds, sometimes the doctors will, we have 2 and now 3 sort of main medications that we're using here at the clinic, and sometimes they won't have any particular reason to go to one or the other, so sometimes it may depend on their other medications and that, so I just try to help them with any of those types of decisions, whether there's anything that could be a conflict with their other medications.
From a patient's perspective, our hope is that this approach provides a point of access for the patient that they can touch on different components of their care in one setting and in one stop, so that they're not having to come here, go to the Cross, multiple appointments in order to see different specialists.
The cancer journey is a scary one, as I've talked about, and being able to be there for patients and discuss things with them, explain things to them, I think is really important. And this just falls under that realm of GU oncology, of treating patients with prostate cancer and helping patients with prostate cancer. It's where I feel like I'm helping the most. It's so important to consider the patient experience because this is about the patient. The patient is at the middle of what we're doing, and we are all around trying to provide the best care we can.
The things that do work when you put effort into them and things are positive experiences, I think it is really gratifying, and I think for us as the providers, it's given us an opportunity to I mean, have a little bit of an opportunity to shape the patient experience, and it's been very gratifying to see that that has been positive. Ultimately, we strive to do as healthcare providers is to care for people and not just manage their disease, but care for them as people and individuals.
I think success ultimately is what patients are reporting, and I think we've seen from a number of patients that they feel listened to, they feel appreciated, and they feel like they've had an opportunity to meet with everyone who's involved in their care. I think the ability to contact the nurse on a regular basis really provides them a lot of comfort, feeling that they're not lost in the healthcare system. Having that point of contact probably provides with a lot of reassurance, and to me that's how we would measure success.
We have people that want to work together, and we have a great quarterback in our nursing and pharmacy coordinators, because they really are the common piece between the patient experience and this clinic. So this is really an exemplary model of how a team comes together and how all the healthcare members work to their full scope of practice to be able to have their own personal job satisfaction, and that comes back to the patient many-fold over because they're providing that care that the patient deserves.
Our Epicc group is very unique because we do come from two different buildings. You know, we used to sort of stand alone very differently, and this is where the urologists work and this is where the oncologists work. So this clinic has done a really good job of bringing us together physically, where we can work face to face, and that's extremely unique. As far as I know, this is the only model of care that exists like this in Canada.
What excites me about Epicc is that I can work in a clinic where my urologic surgery partner is right there, my radiation oncologist is a few feet away, and I don't have to worry about trying to find all of my partners in the care plan, and my patient is right there to be able to have access to all of these people at once. So it really exemplifies the team model of care. It's just really wonderful to bring all of those services within a few feet of each other for the patient.